Hey guys, Dr. Tommy Rhee here, and today we're going to talk about those of you that have knee pain but still want to work out the legs. So one of the big things that we understand about knee pain is that we constantly use it, right? There's no rest period, but we have to use it, and then sometimes we have to limit our range of motion or exercises, and that plays havoc with our exercise routine. So what I like to do with my patients is that find out exactly what they're dealing with, right? So is it osteoarthritis, is it tendinopathy, tendonitis, cartilage, or those ligaments? So we put them to the whole battery test, and then when we get down to what it is, it could be just basic, like a tendinopathy or a little bit of degenerative or some type of arthritic situation. Well, in any case, they still want to work out legs, and it's about really like moving the joint, or is it moving the muscle? So I want to look at the muscle, right? So not so much the joint, but the muscle. So I start them off with a simple test, isometric on the squat hold. So I put the patient in the position of elbows on the knees, set that out, arch your back, hands up, and we hold, right? And it puts you into a squat position, but I want them to feel the load in their hips, not their knees, their hips. If they feel the pressure in the knees, they may be too far forward. Push them back. Weight distribution on the heel, hold it, right? And see where the limit's at. When they start saying, okay, I feel the pain, and you're at 30-second mark, okay, so you know where you're at. So then, now we go in the power plate. Same position, no actual motion. We don't want no mechanical movement. We just want the loading of the muscle. We'll put this on a setting, let's go about 35 hertz, okay? We'll go to frequency, 35 frequency, and we're gonna try to push for a minute, right? Now this one, I'm gonna turn around because I need my space. So the same position. So I'm gonna put my elbows on my knees, arch back, hands up, hold, pressurize the hip. I wanna feel the pressure here, not on my knees. I feel it. The pressure feels exactly where I want it. I don't want it on my knees, I'm feeling the pressure. And it is taxing my quads, my glutes, and interesting enough, it's getting me into a proprioception of my feet. So I feel the pressure, and it feels great on my hips and on my knees. Let's say we're at a minute, okay? We finished the minute up, and we stop, right? So now, we may do that maybe 2-3 times, okay? Give yourself a minute rest in between. Shake it off, give yourself another minute or two. Let's retest, okay? So your leg's gonna be taxed a little bit, but we're gonna indicate a pain in your knee from the first time we test on the ground. Again, we're back in that position, elbows on the knees, arch back, hands up, start your clock, hold. Now we're gonna find out, and we're going into it, right? We're at 10 seconds, 30 seconds. Now we're passing the first point of the knee pain at 30 seconds, and we're at 45. So now you know that you're on the right pathway. So you're not taxing the joint, you're taxing the actual muscle. And power play will help you do that without the actual motion of an eccentric, concentric, but the isometric taxing the muscle. Thank you very much, guys.